I'd like to talk about flu and flu shots, Dr. Davidhizar. Are flu shots actually helping? Are they not helping? We seem to be now these days getting a flu season 9 times a year. It looks like, I don't know whether I'm wrong, but that's what it looks in my office when I look at people not coming to work. Tell us a little bit about, this, big problem of flu, which has been around for 1 million years now, I think.
Well, influenza has been a chronic, sort of a problem of a long time. We've been giving flu shots every fall for as long as I can remember. I remember when I was in college, they had an automatic gun. They just lined us all up and shot everybody with it.
Right.
But so we've been doing it for a long time. And actually, we've gotten a little more strict with how we use it. People that are young and healthy really don't need it. Real young children with chronic, or anybody with chronic disease should have it. Anybody that's diabetic, has heart disease, high blood pressure, those sorts of things. Because when they get the flu, frequently it's much more severe. It can be more debilitating. So the rule of thumb is if you're over 65, you should have it as well. And there's some of my patients are really in pretty good shape over 65, so I sort of give them a choice. But most people that have chronic illnesses that are over 65, I recommend they take the shot. One of the problems with the shot is that some people get a mild case of the flu, and so, where they might have not got the flu at all otherwise. So it's the sort of thing you have to balance as to which way they'd be more beneficial. But in most cases, they're better off taking the flu shot. Because flu can be serious illness for some of the older people who have chronic illnesses.
I see. So is there anything rather than the flu shot, let's just say A, in prevention, and B, if the flu starts coming on, which people should do, such as putting their head under a hot towel? I'm just kidding, but the point is that, that's one of Grandma's methods.
Yeah. Well, the important thing is once a person has the flu to sort of stay away from everybody else so you don't keep spreading it around. And flu is spread mostly by what they call fomites. When you cough or sneeze, little particles of water are expelled from your mouth and your nose, and those carry the virus that causes the flu. So the big thing is to wash your hands frequently. If you've got the flu, or even just any time, you should be doing that, but especially if you have the flu. And if you have to cough or sneeze, do it in your elbow, or cover your mouth if you have a Kleenex. If you don't have time, sneeze into your elbow. And if you're going around a lot of people, wear a mask or something too. But the best plan is sort of, if you have the flu, stay home, stay away from people until you're healed, and then you can go back. That really stops the flu episode. When they had that big outbreak in Mexico and a couple other places, they just shut down all common meeting places like restaurants and hotels, and once they shut that completely down for a while, the flu stopped. So it's the masses of people being together with one person having the flu is how it gets spread.
Well, wasn't that when you refer to Mexico? Was that like a year or two ago? It was the swine flu.
That was 2 years ago. Yeah. And where it was, Mexico City was especially bad hit. And they just closed everything down for a week, which is a hard thing to do, but it was the right thing to do, and they stopped it.
So, all right. Now, what about, supplements, be it vitamin C, E, high dosages of it and stuff? Does that have any effect, in your opinion, or what's the deal there?
Well, that does help. As long as you get your immune system doing better, you're more likely to resist the flu. There's been recent studies that show that even vitamin D has an effect on it, and most people don't get enough vitamin D. We now recommend 3,000 international units of vitamin D. I used to say 800 was sufficient, but all the new data shows that we really aren't getting enough. I live in Alaska, so we don't get near enough vitamin D here. I try to encourage all my patients to take at least 3,000 international units a day, and that helps a lot. And of course, the other vitamins too. They're all good antioxidants, so they all help with your immune system and help fight off disease. So that's always a good thing to do. But in spite of that, some people still get the flu.
Right, I understand. Yeah, I do think something you mentioned about like if and when people take supplements. One of the reason supplements sometimes have a bad rap, and I'm not saying it's the only one, is that people simply don't take enough. You know, so by not taking enough, I have seen people saying, oh, I take one of those whatever candy vitamin C enhanced, and there's like 500 vitamin C in it, and I take a couple of them a day. Oh, and it's just, if you look at Dr. Pauline, I think it's Dr. Pauline who was like the original.
Linus Pauling.
Yeah, Linus Pauling. He's talking about 10,000 and stuff like that, and not every few hours if you really, have it heavy. So now you say also like 3,000 vitamin D versus like the few hundred, which normally people kind of go, oh, I did my dose and it doesn't quite work. So basically, overdose. I heard one doctor one time saying, you can't drown people in vitamins. It's not possible. Maybe you go and get a little diarrhea here and there, then fine, cut it back. But rather than that, it's not possible. And they always go out of the body within hours anyway. So is that true?
Yeah, most of them are water soluble, so that's when you take a lot of vitamins, your urine turns more of a yellow color. That's because your body's going to dump out the extra, and it doesn't last that long. So you have to keep taking them every day to make that work. Mm-hmm. But that's true. It does go through your system fairly quickly, mm-hmm. But it does help a lot too in the meantime.
Okay. So anyway, flu. Sometimes a vaccination is okay, sometimes it's not necessarily. You only suggest it when people have already a lowered immune system for some reason, and rather than that, you actually try to stay away from it if possible, without giving it a blanket statement. And when you have the flu, stay away from people so that they don't get it, and most likely when there's a flu out there, many people have it, so by staying away and being away from all the people, you might get over it faster.
Correct.
Okay. All right. Thank you very much, Dr. Davidhizar.
You're welcome.